And I'm coming to you live from AU Medical Center, where we are celebrating National Hospital Week. And I'm here with our CEO, Ms. Liska. And today we're going to be talking about the theme of this year's National Hospital Week, which is caring for our community. And so we're going to talk a little bit about how AU Medical Center is fulfilling that mission and how we care for those in our community. So let's talk a little bit about what AU Medical Center does to strengthen our community and how we work directly with families in need.
I would love to do that. One of my favorite topics. So AU Medical Center is very unique in the community, and I think this is how we do address and take care of our community, because we have the highest level of care right here next to the university. Of course, we train our physicians, we train our nurses, we train our therapists, all of our staff. Most of them have gone to school here and remain here to continue in clinical care. And so having learned the latest technology, learned the latest treatments, we're able to give that back to our community. And then specifically the vulnerable, they have a special place in our heart. And it probably depends on how you define vulnerability, because it's just not economic vulnerability. There could be other sociological issues, but also being frail. Many of our elderly in our community may not have socioeconomic issues, but they may be the frail and the elderly. So we can really take care of anyone from birth to being a geriatric patient, again, with that academic difference, which means that we can take care of the highest level of care. So we get transfers from all over the region when they can no longer care for a patient in their hospital. They either don't have the physicians, they don't have the nurses with the latest technology or thinking. And so I think that's how we take care of the most vulnerable, because it could be just the care that they need that's making them vulnerable.
It's nice to have those resources right in our community.
It is.
That's for sure. So what would you say are the resources that we provide that are available for the families that are in need? And is there any advice that you would give to our patients before they come in for their appointments?
Well, I would say the resources first that we have are just an exceptional care team who are used to taking care of the sickest of the sick. So again, our physicians, our nurses, our therapists, our bedside staff, all of the people who clean and feed our patients are very adept to this vulnerable population. But we also have a number of social workers for both our pediatric patients and our adult patients. We have financial counselors. We have pharmacists up in the ward. So these are some of those additional wraparound services that we're able to give our patients, and I think that is an extra step of how we can care for our vulnerable. Of course, we have the region's busiest ED, the emergency department. And so when our patients are in need, they can come right here 24/7, and they're always going to have a faculty physician and a team that is ready to take care of their every need.
Awesome. So how are you inspired to do good outside of the walls of this hospital and in the community? Does anything here specifically inspire you to do good to others in the community?
Well, I love to listen to patient stories, and it's part of why I'm so focused on the patient's experience, and I personally like to round on patients. It takes our leaders out of the office. It puts them right in front of why we do what we do, the patients and their families, and that's what inspires me. And you had asked an interesting question a moment ago of what advice would I give patients when they're coming to AU Medical Center? Because we're a big academic organization, sometimes that can be intimidating. And so I like to suggest that patients bring a journal with them for either their outpatient appointments or their inpatient stay. And the reason why I like to recommend that is just from personal experience. All of us have family members who have had clinical care, I'm sure, sometime in their life. And I think by bringing a journal, you can write down the questions that you have for the physicians or the nurses in advance of the appointment or the stay, because often in the stress of that period, you forget what to ask, and you go home upset that you didn't mention this one thing. So that's a way to prepare for the visit. And then what I always like to recommend for my family is that if you're with somebody else, that they take down notes of everything that the physician or the nurses say. And in that way, you can go home and reflect on the appointment and be really prepared, perhaps with some instructions that you heard at the time but might have forgotten by the time you get home. So I really like that journaling recommendation for patients and families.
I love that. That's a great suggestion. Yes. So when you're out rounding or when you see patients, what really puts a smile on your face or helps you connect with our patients?
So I always like to disarm patients by really not knowing who I am, and I'm not trying to play a game, but when they ask me what I do, I say, well, I'm here to support our team, or I'm one of the administrators. I don't like to use my title or my rank unless they're really pushing me. I just want to connect with them. I love to help a lost patient or their family get to where they need to go, because our organization, like many organizations, we're very hard to find in terms of specific hallways or specific buildings. We used to be one hospital that has grown and grown. So helping patients with that wayfinding is really important. I also like to talk to them on the elevator, ask them how their day's going. I do that with physicians too.
Sure.
How's the hospital treating you today? And it's disarming, but you can get a lot of information that way.
Yeah, that's great. So tell us, do you feel a sense of loyalty or pride, even empathy, because of some of the things that our hospital does for friends or for family or even you personally?
I do. I've been in academic healthcare most of my career, and I think because of the cutting-edge technology, cutting-edge care and research, that's what brings me back to academic healthcare administration all the time. And so I'm proud of the discoveries that our teams are making every day. And again, that's not just physician research, that's nursing research, and it's Nurses Week today too, as you said. But it's our therapists, again, all of our bedside staff are doing just amazing work, and it's exciting to be part of an organization that has the best physicians in the region, because they're always selected by their peers as the top docs. But also just what we can do on a weekly basis in terms of new discovery makes me very proud. And I'm always sending out our stories to family and friends and other colleagues in other organizations just to know what we're doing. And so that's what really gives me pride and why I choose academic healthcare.
That's awesome. So what do you feel is one of the greatest things that we do here at AUMC? If you had to name one thing that was the best thing that we do.
That is really tough. I think I love the responsiveness that we can provide in a time of crisis. So the fact that we are a level 1 trauma center, which means if a trauma happens, whether it's an accident or blunt trauma or a fall to the head, we know how to treat that unlike anybody else in the region. But the same goes for pediatrics, and we are level 4 nursery, so level 4 neonatal intensive care unit, which is the highest level of type of care that we can give for premature infants or infants in distress. And I'm very proud of that. When you see the devoted teams in our NICU, it's incredible. So again, I think it's our critical care, I think it's our traumatic care, I think it's our infant care. It's really everything. And I don't like to talk about just one unit because they're all codependent on each other. So even though someone might start in critical care, they move down to regular, they might be step-down care and then regular floor care, and then they can go back to our clinic. So it's a whole continuum of care that I'm particularly proud of.
That's awesome. So is there anything you feel is our best kept secret or something that's truly amazing that's not really talked about or noticed?
Well, I think it's a lot of what I've already said. And again, academic medical centers can be very intimidating. You might not think about AU Medical Center unless you have a trauma, because, we're on the news so many days because of a traumatic injury coming to our hospital. So I would say people might be intimidated, but they shouldn't be. Once they get inside our walls and meet our physicians and are taken care of as an inpatient, then I think they say, wow, I thought AU was really different. And it's very special, and it's not that scary. We're working on that wayfinding and that customer service touch all the time. We're working on our branding, as you can see behind us. I think it's very exciting, and I think our staff and our patients and the whole market is going to feel this new level of energy that is coming out of AU Health. It's a very exciting time.
That's awesome. So is there anything else that you want to add, maybe for our hospital staff or I know it's, again, National Hospital Week, but
It
it's
is.
also Nurses Week,
It
so we're
is.
celebrating a lot this week.
And these very special weeks are colliding, but I actually think it's great because we don't need to single out just one discipline. Now, I love our nurses because they are the largest number of employees in one discipline, and they take care of our patients 24/7 at the bedside. And our hats go off to you, but it's really an entire team. Again, it's the people who clean the rooms and the people who feed our patients and who come and do blood draws that are equally important to our care teams or extend them so they can focus at the highest level of care. And so I just say thank you to all of you for everything you do. You're all part of our incredible team, and we thank you, and that's what we want this week to be all about.
Thank you so much. And again, happy National Hospital Week, happy Nurses Week, and that's it.
Thank you.